Of the show for today. We're talking to Professor Vicki Williams. The topic is the program of social work at Tennessee State University, and she's given us some information relative to some of the progress that this program has made, in addition to some of the information in reference to the current health bill that we will talk about later. Why don't you give us some additional information in reference to what the program itself?
Yeah, first I want to say, before I talk about the health bill, is that we are very fortunate to teach a class. I teach a class on social welfare policy, and in that class students are engaged in projects. They have to choose a legislation to review and to present in class.
Okay.
And one of my groups last fall chose the healthcare reform bill that was introduced in Congress last fall. And they did an excellent job in discussing the bill and what the intentions and the goals of the bill were. And what was stressed in their presentation is that what we'd like to see occur as a result of this bill is that more individuals can be covered, especially individuals who, middle class and working class poor, can be covered with this legislation, in that it would provide a safety net, or at least they will be able to be more involved in preventative services. The issue with the healthcare bill is that we're trying to make sure that if 90% of the people have health insurance, then they're able to have health care on an ongoing basis. They do not have to wait until something critical catastrophe occurs, a catastrophic illness, before they're receiving help, because that's where the cost comes in. These are the individuals that go to the emergency room, and we still in turn have to pay for that. I think that's what people don't understand. You pay one way or the other.
Very good.
And so it seems reasonable that you'd want to pay less if in fact people could receive ongoing preventative care, or even engage in some wellness kinds of activities that could be paid for by the insurance. And then in turn, that lowers the cost of health care.
For everybody.
For everybody. So it's the kind of system where everyone has to be a part of it in order for it to work. If some people are left out, then they end up in the emergency room very sick, and then we end up paying more for that. There are other ways to lower the cost of health care, and I think Obama spoke of one way, which was to make sure that everything is done electronically on the computer, and that would reduce the cost, the paperwork, and so on involved. And so there are other ways to reduce the cost of health care, but the less people that that need critical care, the less people that have to receive critical care, the better. The more that everyone can have access to a primary physician, for example. Of course, we need more of those. I mean, it's ironic that with our healthcare system here, the physicians that have been probably doing better or are able to receive the most in terms of their income and so on, the specialist, because people end up, they're seeing more people because of the fact that people come to see them after they've reached a critical point in their health situation. So we need more primary physicians in order for this legislation to be successful, because these individuals need to have someone that they can go to on a regular basis and have checkups on a regular basis, and can be treated, or at least be in a position where they can receive if it's medication or they need to change their lifestyle, that they have that kind of services provided to them. And that's what being insured could provide to them. I mean, the other big controversy was this whole idea about government health care versus the private insurance companies. And you know, like in Canada, for example, they have that single payer program where the concern was with that kind, with government health care, that there would be accessibility would be a problem. People would have to wait a long time before they could see a physician, and so on and so on. That was the concern, and that you would not receive the kind of quality care that you're receiving right now.
No, well, that's a question.
And that's not necessarily true.
Well, that's,
you know, it depends on what kind of level of care are you talking about. If people are going in to have their blood pressure checked and other kinds of care that where they're being maintained, so to speak, a maintenance process, then that's less expensive, and maybe you wouldn't have to wait that long. But if you're seeing a specialist and they have to decide whether you have to have major surgery or open heart surgery and all that kind of thing, then maybe there would be a longer waiting list, because that entails more physicians, that entails hospitals being more prepared for those kinds of surgeries and so on. So it's a complicated issue. Believe me, it's a very complicated situation, and you really have to sit down and study the bill.